All right. Well, thanks so much for joining me, folks. I'm so excited to chat about at-home ultrasounds that we've pioneered here at Sama Fertility. Um, I would like to introduce Dr. Mayor Olcha and our head of ultrasound monitoring operations, Jessica Galante, on the call. Dr. Olcha, do you mind sharing a little bit about yourself, please?
Yeah, sure. So nice. I'm glad that we could do this, and hopefully people find this interesting and valuable. I'm Dr. Olcha. I'm the co-founder and chief medical officer at Sama Fertility. I'm a board-certified reproductive endocrinologist, which really means that I take care of patients doing different types of fertility treatment cycles as well as diagnostics. And happy to be a part of the team at Sama, hoping to kind of push the envelope to improve the access to care to patients and just make it easier for everyone to be able to go through the fertility journey.
Thank you so much, Dr. Olcha. And Jessica, a little bit so that our audience is able to understand how you got involved in the project.
Of course. My name is Jessica, and I am the head of monitoring operations. I am a sonographer by trade, and I got involved in at-home ultrasounds a while back. I've been doing these about 4 years now. It keeps me going because patients just overwhelmingly love this opportunity, and being able to offer this type of care to patients in remote areas, patients who need this, has really just kept my drive for it and making it work. It's been an amazing experience overall, just being able to help patients through their journeys.
That is so true. It is an important thing because today in the US, 1 out of every 25 people that need treatment, in fact, end up receiving treatment. So there is a big delta. And of course, there's much more than just geography at play here. But I think geography is one of the most major factors that are going to be addressed with an at-home modality of care delivery within fertility here. So I think the mission statement there is super evident, but I think the first question gets directly asked to Dr. Olcha here. I mean, you're an expert, you're a doctor, at home ultrasound. I mean, that sounds, almost fantastic. Does it work? Do you have any evidence? What sort of work have you put in to actually make sure that this is safe for our patients?
Yeah, it's a great question. It's a common question, and the short answer is yeah, it works amazingly, and we have some data to support that, and we have a lot of very successful patient journeys that we've done in the past couple of years, and a lot of wonderful, beautiful, happy ending stories with babies. So we're super excited about that. I think that probably Jessica can get maybe like in the specifics of how it works, but maybe, before we get there, the basic premise is that you do the ultrasound at home rather than coming into the clinic, and that is going to save a lot of time and effort from having to travel back and forth, having to wait in a waiting room, having to be scanned by a different sonographer every time, having the discomfort of maybe being in a place that you're not so comfortable with, and definitely even around women who might just want to freeze their eggs. They often want to do this quietly, and at the comfort of their own house. They may not necessarily want to sit and disrupt their life going back and forth for appointments. So it can definitely be done. And we actually looked at this recently, and we presented this at ASRM, which is a national conference that a lot of the fertility doctors and experts go to. And basically what we said was, well, look, let's look at the patients that we're doing at-home ultrasound, and let's look at a group of them, and let's find another group of patients that still came through our system, that were similar in age, similar in egg reserve hormone markers, similar in height and weight, but had their ultrasounds done in a clinic or in a radiology office, which is like pretty much the standard, right? And then let's see, did one group of people do better than the other? And it turns out that they didn't. They did pretty much equivalent, which we're really happy about. We looked at the number of eggs that were retrieved per cycle. We looked at the number of mature eggs. We looked at the proportion of mature eggs as well. And all of those factors really were equivalent, whether you did the ultrasound at home using our system, or whether you did it by going to a clinic or to a radiology center. And that's really amazing news for women out there who are thinking of either freezing eggs or doing IVF, but maybe are having some access issues in terms of just finding a location that's close to them, or simply just don't want to disrupt their day-to-day life.
That's phenomenal. That finding is something that we should definitely link in the comments, or the description of the video. So that is incredible. You did mention that patients do this at home. So could you explain a little bit more about the actual experience the patient should expect here?
Yeah, you want that to go to me?
Yes, please.
Yeah.
Dr. Olcha. I think that one is something that patients would be interested in hearing about from their doctor.
Yeah, so we started this like I would say now a little over 2 years ago, and the goal was to find a way to get good imaging and good data from patients at home. And so it's gone through a number of iterations, but it really works in this fashion. We are able to physically send a device to the patient's house. So it's a remote ultrasound device. It's fairly small. It comes shipped in a box. It's battery powered. It's connected to our infrastructure using a cell phone and some cell towers. So the data connection is cellular. And we are able to, with our platform, set up different monitoring dates where you're requested to have an ultrasound done. And so that request comes from the clinical side. And just like if you were in a typical office doing egg freezing or IVF, that, those doctors might say, okay, on Monday, we want you to have an ultrasound. And so we would follow those orders, right? They would look, the sonogram team would look to me, to my orders. Or if you're doing this through your own IVF facility, we would look to your IVF doctor for the order of when they need the ultrasound done. We would ship you the kit. And basically, the patient retains and holds on to that kit for about 2 weeks. And that should be enough time to go through the whole cycle. And the actual ultrasound is done at home. It's done guided by one of our sonographers, or Jessica or someone else on her team. But the physical aspect of putting the ultrasound in is done by the patient, and it's pretty simple. I think we've had some really great feedback. I want to make it very clear that the patient's not alone. It's not like we're just giving you this thing and go figure it out, right? You're really sort of like you're holding your hand through every step of the process, how to put the probe in, how to move it to the left or to the right. You don't have to know what you're looking at. I mean, that's why we have our team, right? You just need to know how to position it left and right, which is pretty easy to do. Our team takes all the images and the measurements, and then we teach you how to take the probe out, how to disinfect it, how to charge it, and then how to prepare it for the next visit. And that whole thing really, doesn't take more than 10 or 15 minutes at most. And that's probably the first visit. Once you get comfortable and you're doing the second scan and the third scan, I think we're finding that those visits are shorter, closer to maybe even 6 or 7 minutes per ultrasound.
So that is incredible. Like essentially very standardized and a very normal process is what any patient should expect during this entire workflow here. I think you mentioned a little bit about the equipment, and I want to ask Jessica to explain a little bit more. And if do you have any of the devices that you're actually able to show our patients in terms of what they should expect when they get whatever they do in the box?
Yeah, sure. I have a box right here. I'll grab it for you. So you'll receive everything in our easy packaging. It's able to be reused to ship the device back. So the patient will receive it just like this. And let me just pull this out here.
While she does that, I think it's important to know that there's nothing on the outside of the box that would indicate that you're doing any kind of fertility treatment or egg freezing treatment, right? It's really, very discreetly packaged.
Yes. And then on the inside of the box, you will have the SAMA label packaging. Everything is secured in here. This is what the device actually looks like. So it's fairly small, easy to hold, easy to maneuver. You're also sent all accessories, charging cords, and all the ultrasound equipment you need for the exam. We include probe covers for all of your ultrasounds. We also include wipes for in between your exams and ultrasound gel. So I just wanted to clarify on one point Dr. Olcha made was that patients were disinfecting. Yes, they'll do the disinfecting between their scans, and we provide a new clean probe cover for each exam, but they will not do the high-level disinfecting that is done after the patient is completed. So all of our probes undergo regular HLD high-level disinfection, just like we would see in a clinic or in a hospital setting.
Between patient uses, that is, correct?
That's right.
Yeah.
Yeah. Okay. No, that is important to note. So, you've taken into account the fact that these are going to be used by, a single patient for the span of the 2 weeks. So, you're disinfecting them intermittently with the wipes, and then there's a central facility where all of these are getting high level disinfected between two patient uses. No, that is incredibly important to point out. So thank you so much for showing that equipment. It looks small. Is that comparable to the kind of power that you would expect a doctor's office equipment to have? And is it clear? Like all these images, are they good quality, Jessica?
Yes, I've actually used devices and gotten like in clinics, depending on what machine you're using, it depends on really the equipment you're using, how the images come out. And I've seen incredible images on this device. Every time I've used it, I can show some of those images if you'd like. I just need to pull them up. But I haven't seen any real difference other than, if you're in a facility with an older equipment, those images will not come in as well. But the ultrasound tech, while on the appointment with the patient, is able to control all of the image optimization settings, everything that the sonographer would be doing with their hands during the appointment. We're able to do all of that directly to this device remotely. But let me pull these up and see if I can.
And while you do that, right, I think Dr. Olcha, the question definitely goes to you as somebody who is seeing these reports and these images. As an REI, we recognize, frequently in the field, a majority of the doctors would perform these scans, themselves. There is a variability in terms of operator, the efficiency of the operator, the way that images are taken, if doctors doing them versus not. Could you attest to the fact that these images are something that you're okay with, that you're happy with?
The obvious answer is yes. Having started the program myself and having done, the first like 50 or so scans. But I would say the image quality is fantastic. I often will show this to friends of mine who are REI physicians. And they have no clue that it was done by the patient at home. And then when you tell them later that, by the way, this was done by the patient at home, they're just in utter shock. So the images are really good. They're definitely on par with the traditional machine that you would find at a clinic. And I think like one thing that's kind of really cool that maybe, we didn't truly expect at first, but we sort of got later, is the fact that it really changes the patient's sort of like relationship she has with this whole journey, because they tend to feel a lot more involved, because they can see the images, they're kind of controlling the machine, and I find that the patients feel a lot more empowered when they do this, because they're like part of the journey, right? It's not a black box where you just go in and go out and you don't know what's happening. They're intimately involved with it, and I think that's probably one of the coolest aspects that maybe we didn't appreciate would occur right off the bat. But having done a lot of these scans and now having had feedback from patients across the country who do this, that's something that's been really special.
No, I appreciate that. And Jessica just showed some images that I don't think are visible on the screen anymore. But if, Jessica, just for a minute, if you're able to put up and just explain why these are good quality images to patients that might be looking at this.
Yeah, of course. So here are just some typical images you would see in a scan for your follicles and your endometrium. You can see that we have the ability to do measurements right on these. All of the borders are crystal clear. I know that doesn't really mean much to people who aren't familiar in ultrasound. It's just depicting different shades of gray, but these are very, very clear images. You can see these black circles are the follicles and the ovaries. You can see the endometrial stripe, and they come in super clear, and we're able to make accurate measurements just as we would on a machine in the clinic. We're able to adjust the depth and everything that we would need as an ultrasound tech who is doing one of these exams.
That's amazing. But I mean, one of the questions that we are quickly going to be asked is, does this work for everybody this well, or are there any exceptions to the folks that we would be able to operate in such a remote fashion with Sama? and maybe that one, Jess, you could start off with our current requirements around the table for how we accept folks into the at-home program. And Mayor, maybe you can tell us a little bit about how they've evolved over time.
Yeah, so we do require a medical approval process, and images from a previous ultrasound exam are required in order to be approved for use of the device. Then once we receive those images, those are reviewed by our team, and we make sure that this is a fit for your treatment cycle. So something that could make it so that you were not approved would be that your ovaries are extremely hard to visualize on ultrasound, or different pathologies that cause artifact and shadowing, and we want to ensure that we're getting the best possible images that we can, and that's why we require the image prior approval for that. We also have other minor things such as, cellular coverage, home internet access, and if the patient is comfortable, of course, we want to make sure they're comfortable before they would get involved in this type of ultrasound. But those are our basic requirements, and we can typically tell based from, review of their medical history and their ultrasound images that this would be a fit or not, and it has worked for our patients so far for us to get great images at home.
Yeah, I mean, I would echo everything Jessica said. We came up with those requirements because we primarily want to set people up for success. I mean, that's really what the requirements are there for. We want to have as much reassurance as possible, and we're well over 90%, maybe 98%, 99%. Sure that if we send you the device, you will be successful, right? And that's where those requirements come in. We want to avoid situations where we send someone a device and they're not successful. Those are extremely rare, but that's why we have some of those requirements. I think some of the requirements have changed a little bit over time as we've gotten better and better with the technology, and as the technology has improved. And so that's good news, and hopefully we continue opening up those requirements.
That is great news. I think a little bit around the operational side needs to be, we are offering at Sama at-home ultrasounds. How does this work out with an existing clinic? How do the results in fact go over to the doctor? Do they make their own time? Because we all know how important it is that the clinical teams at these respective clinics get the results, same day stat, and they're able to make their decisions around how the fertility treatment is going to change in the coming days. So how does that work, Jessica?
Yeah, so actually it's very, very easy. We handle all reporting, and the ultrasound report actually goes right to your physician within minutes of completing the scan. So we send the report, all measurements, and all images, usually within 3 minutes of completing your scan, and your physician will receive it right away. And something that we do that not all clinics do is that we include the images in the report so that your physician can actually directly look at them without just seeing writing on paper. They can actually look through everything and make sure that everything's looking okay.
Oh, that's awesome. So the next step, I mean, obviously, is uh, the cycle is completed here. What happens with the device?
So at the completion of the cycle, when a patient is scheduled for whatever procedure they have, everything gets boxed right back up into the SAMA packaging. And there is actually a strip on here for easy sealing. They close them right back up. And there's a prepaid shipping label in the box as well. Patients put that right on top, and they drop it at their nearest FedEx or UPS location. And that's it. They just ship it right back in the packaging we provide.
Oh, it's so cool. Patients definitely want to just hang on to it. There's not much that they can do with it, but I'm pretty sure that, after the experience itself, maybe patients might develop some kind of, they really like this, don't they, Jessica?
Oh, they love it. They love it. I actually hope we get more ultrasound techs out of it, more people wanting to study ultrasound. So yeah, we do. Our patients, every patient that I have had has enjoyed their experience, has felt empowered by it. Even those who, like, I'll get a handful of patients who want to look at everything, want to watch while I'm scanning, want to see the measurements, and then I'll get some who want to leave the phone in the other room so they can't see anything. And even the patients who don't want to watch, who don't want to see what's going on, still feel empowered by their journey because they feel a closer connection to, their clinic and their ultrasounds than they would if they were just going into a clinic. So it's been really, really cool for me to watch, for me to help the patients go through this and answer their questions while we're scanning.
That's great. One of the things that sort of spurs in my mind is, if as we wrap up the conversation today, if Jessica, you and Dr. Ulcha, you are able to maybe have an example of a patient and a conversation that you had with them around the at home that is super memorable to what their experience was at previous clinics and how the at home in fact ended up changing the way they thought about fertility care itself.
Yeah,
Do
I
you-
mean, I'll start off. A lot of my patients have just, it's been about the commute, about the commitment, and about the stress of going through an IVF cycle. And, at the end of our experience doing the at-homes, I'll ask my patients how they felt their experience was. And they always are like, it was so much easier than I thought. So one thing that I, of course, would be concerned about is patient ease of using the probe and getting the images that we want, or feeling any pain during the process. But our patients have felt that it's super easy and easy to follow the instructions, but their main positive feedback has just been that they don't have to interrupt their busy daily lives. They don't have to travel for these cycles. Patients who live 3 hours from a monitoring facility, they no longer have to make that commute every other day to get their care. And that's been the feedback for me. And they just are so thankful to be able to have this opportunity and take control of their care and actually embark on their fertility journey and go through the treatment that they need without uprooting their lives.
Anything from you, Dr. Ulcha? Any interaction that stands out?
Yeah, I mean, I think on a whole, I've kind of gotten the same feedback. Um, Patients are always a little bit concerned in the beginning about how easy or difficult this will be, and often I think like their biggest fear is that they're going to do something to mess up the cycle, and very quickly, they realize that there's really nothing that they're going to do or can do to mess up the cycle, and that 99 out of 100 times we get really great imaging, and even in the rare cases where there's an issue with the imaging, we always have a backup plan, and so all of our cycles have been very successful.
Now, that is incredible. I mean, patients spend close to about 160 hours during their treatment. And the goal at Sama is to reduce that by at least a fourth to start off with. And I think the at-home ultrasound is, probably one of the most meaningful steps in that direction. Thank you so much for joining me today and answering a lot of the pressing questions that we frequently heard from our patients, and in some cases from other professionals in the field, doctors and ultrasound technicians. Really appreciate it, and hopefully we get to chat soon again. Bye.
Thank you.
Bye. Thank you.